Good afternoon. The Committee on the Whole is called to order, but due to a lack of quorum, we will stay on recess until we reach the quorum. Thank you. Committee of the Whole is called to order. Colleagues, we are on Chapter 3, Part 1, Guam Memorial Hospital. It was requested by our colleague that we have GMH here. We have the administrator and the comptroller. We can invite them in, please. Colleagues, be reminded that there's no amendment, and no amendment will be accepted. It's just for a discussion. Unless you raise your hand, you want to discuss something. Otherwise, we're just going to skip everybody else. Don't need to go row by row. Okay? Open discussion, that's all it is. At this point, I'd ask the GMH representative to please stand while the Sergeant at Arms will swear you in.
Please raise your right hand. Under penalty of perjury, you all affirm that any and all information you provide today, whether it be verbally, electronically, and in writing, be the truth, the whole truth, and nothing but the truth. Mr. Chair, under oath, you may proceed.
Thank you. I'd ask the Guam Memorial Hospital Authority folks to please introduce yourself, and then we'll begin with Senator Blas.
Good afternoon. My name is Lillian Perez-Posadas.
Good afternoon, Yuka Hechanova, CFO.
Thank you, ladies. Senator Blas.
Thank you, Mr. Chair. And ladies, thank you very much for being with us here today. I was the one who had asked for you to come on in so that we can talk about the finances of the government hospital. According to this, to our budget proposal, GMHA is looking at about $21,714,329 from the GMH, from the Pharmaceuticals Fund, and $8,491,370 from the General Fund. Well, but I was more particularly interested in what your finances are right now, okay, with regard, you know, there was some concern that was brought to this body's attention earlier in the year about the difficulty in being able to make payment, net pay to employees, as well as the vendors. And so I'd like to know, where are we at right now financially with regards to, you know, our payments and stuff? And then also, with regard to, you know, the repairs that are necessary as a result of malware, how are we paying for a lot of that stuff, or where are we getting that? Okay, so, Ms. Posadas?
I'll let you get our CFO
Sure.
answer that.
So to answer the first part of your question, Senator, so as of June 2023, on our income statement, our loss is 8.6 million, which means that our expenses are over our revenues by 8.6 million.
Okay. Now, in this, your 8.6, can you break that down? So what that 8.6?
Okay, so our operating revenues to date as of June 30th is 90.5 million. And our operating expenses, which is our salaries, benefits, contractual supplies, is 137.6 million. And then our non-operating revenues, which includes our grants and our subsidy, is 38.4 million. And so all of that comes down to 8.6 million loss.
So your grants and your subsidies, 38.4. Where primarily is your grants and subsidies coming from?
The grants is mostly from FEMA. We've been pursuing FEMA grants since the pandemic, particularly for the travel nurses that we've had. Mm-hmm. And then the subsidies is from our appropriations from the FY2023 budget.
Okay, and 137.6 million, what was that for again?
That's for salaries. So salaries and benefits is 78.8 million. Our contractual services, which is mostly the payments we make to our contractual doctors, is 30.8 million. Supplies is 14.4 million. Our utilities
Well, how
is
much is the supplies?
14.4 million.
Okay,
Our utilities is 3.4 million. Our expenses for our DOC clinic is 2.4 million. Minor equipment is 1 million. And miscellaneous travel and training is about 400,000. Depreciation is 3.2, and our retiree healthcare cost is 3 million.
okay, so with the amounts that you're getting here in this budget, how do you intend to be able to make good on your shortfall, your losses right now? What do you?
That's a very good question, Senator. What we are experiencing this fiscal year is a tremendous growth in our expenses. It's really gone up a lot. When we were here for the budget hearing, we did express our concerns over healthcare in general across the country has just really been experiencing a big rise in costs, especially for labor, for nurses, for doctors, for clinical technicians and such. They're all costing a lot more. We're having to pay a premium. We still have contract travel nurses on that we're paying to help take care of the patients as well. Another thing we've noticed is a tremendous rise in the cost of supplies. So the pharmaceuticals that we buy and the medical supplies that we purchase, the costs have seemed to go up tremendously.
Okay, are you up to date with your vendor costs?
No,
Vendor payments?
sir.
How much in vendor payments are you?
Our AP right now is around 30 million.
$30 million.
Yes.
And you're aging on that 30 million?
I don't have the aging right now. I can provide that to you though.
Yeah. Gary, just off the top of your head, what is probably your longest?
Most of that is for the travel nurses.
Most of it is for travel nurses. Okay. So we have travel nurses that are providing care that haven't been paid for quite some time?
Yes.
Well, how long?
We still owe, I believe, either February or March. We still
It's
owe.
August.
Yes.
Okay. Your insurance payments, vendors, have you been, with insurance payments, insurance companies been able to pay you?
Most of them, yes.
Yeah.
Yes, we've been pretty aggressively in the last couple of months, been billing very aggressively, and also pursuing the collections of those.
How much do you think you still are owed in payments from insurance companies?
About, I believe about $5 million right now.
$5 million. And we're hoping that it gets better.
Absolutely. Yes.
Pass it out now. Pass it. Mr. Chair, I'm going to take the liberty, if you can give me a recess so that I can pass out this information that I want to be able to share with our colleagues as well as with the panel.
Okay, I just hope it's in reference to the budget.
It is, it's insurance.
Okay,
Thank you.
we were short recess. Committee host, let's call back to order. The documents have been passed out. Senator Blas, if you could continue, please.
Thank you, sir, so that the viewing audience know what I just asked Pascal. This is basically an aging report that was provided, that's been provided to the administration on basically the financial, I guess, the finances of, our current self-insurance program for pharmaceuticals or for prescription drugs and for dental. And I think that for the purposes of this conversation, I'd like for us to be able to take a look at the top of this, the prescription drugs. And you know what? Dispense of everything else that has happened from October to June, but look at the year to date. Year to date, based on the premiums that have been collected, it was about $19,407,137.06. Yet the claims amounts to $27,062,951.84. The claims, there are more claims than there have been premiums that have been collected, and is to the tune of a shortfall of about $7,655,814.78. The 139.45% there represents what the ratio is, claims ratio versus the premiums collected. Normal, functioning, no loss program, that number should be less, 86% or less. It is now 139.45%. My concern here is in talking to the administration, and as far as some of the claims here, I have to be very cautious about, already we have a $7.6 million shortfall, and that's up until June of this year. You still have July, August, and September, and the rate it's going, it's not going to go down. The history in this, and then we have this history, and then we're going to be moving, or proposed to be moving, to a different healthcare plan later. But that's a discussion for later. My concern is right now, how are we going to be able to capture the funds necessary for GMH? So let me ask the question from GMH. Of these pharmacies, and as far as the prescription drug care costs, are you still owed by Guam self-insurance?
Sorry, Senator. Can you please clarify your
Your
question?
pharmaceuticals in the areas of prescription drugs, when you prescribe drugs, do you still have a pharmacy at GMH?
Yes, we do. We have
Okay.
the
So,
inpatient pharmacy.
and is in that pharmacy, do you, some of the prescriptions that are filled are for those government of Guam employees and retirees?
We don't have outpatient pharmacy. We only have inpatient pharmacy.
Doesn't matter. You have a pharmacy, right? This basically covers pharmaceuticals.
We don't have an outpatient pharmacy, so we have the inpatient pharmacy. So the pharmaceuticals are going to the patients that are inside the
Okay,
hospital.
so it still doesn't matter then, that falls into the area of healthcare. And if anything, it's going to be covered by their health insurance, not their...
Yes.
If they have insurance, but
Yeah.
those who don't have
And
insurance.
therein lies another concern, is the
Right.
number of people that you're required to be able to provide services to for those people who don't have insurance.
Correct.
And now you may have an instance where the individuals who are going to be underinsured or basically have insurance, but now no ability or no means for the carrier to be able to pay you, how much of a problem that's going to cause for you, isn't it?
But what I understand with that self-insured is it's going to go into a government of Guam account.
So
And
is
so
this.
the claims will be coming directly from the government of Guam to that third party to the GMH.
Sure. I mean,
rather than,
this is the same thing as the pharmaceuticals and the dental here. It's the same thing. The government of Guam, it goes into a GovGuam account, and the GovGuam, then what happens is the third-party administrator collects the billing from the provider. They, in turn, give the billing to GovGuam. GovGuam turns around, gives them a check, and pays it out. But we're short. And I'm looking at this at the standpoint of keeping you afloat. Okay? Because My fear here is that when we do take on the full breadth of the self-insurance for the government of Guam, a lot of the primary care, okay, or the initial urgent care is going to come to your door.
They already do.
Yeah, which is going to add on to, they may have insurance, but the ability to pay it is going to be something else. We don't even have our history in being able to do that is miserable already. And I just don't want to add on to what may happen to you later. I can see it flashing red, and he's going to tell me to shut up because my time's up. So I'll wait for the second one.
No, I won't tell you to shut up.
Okay.
I'll just have the mic turned off.
Thank you, Mr. Chair.
Does any other colleague would like to speak? I remind everybody, we're on budget 24. I understand the issues and the documents provided is in reference to what's going on today. I hope and pray that it gets better for GMH. But Senator Duenas, please.
I join you in that prayer. May light a few candles. Just a couple of brief questions, and the purpose for which we asked you to come down is we've been contemplating through this budget tracking revenues. And so, you know, in the event that possibility of amendments coming up, we just wanted to kind of get a feel for how the sort of the big three are doing. And it sounds like things are not going so well. So just wanted to recap once again. So the 8 million operational shortfall this time is inclusive of the total 30 million in terms of vendor payables, or that's a grand total of 38 million?
That's the grand total. You're talking about the loss that I explained to Senator
The vendor payables at 30 million, is that inclusive of, would that be your total shortfall, or would it be total 38 at this point?
No, that's inclusive. So okay. On the payable side, those expenses have already been incorporated into our financials. The only thing is they haven't been paid, but we have already recognized them as an expense.
Okay. Do you anticipate any reimbursements of any federal monies or the like for any of your shortfalls?
Yes. So okay. I mentioned FEMA. We have been pursuing FEMA grants for going on 3 years now. So we have one grant ready to come to fruition for the alternate care site. So we expect about $2.8 or $2.6 million from that we hope to that it comes in the next couple of months. And then there's about another 2.2 million coming for the travel nurses. So the issue with the travel nurses is FEMA will only pay us for the time that we had a considerable amount of COVID patients. But of course, when we have the travel nurses, we don't send them home as soon as we don't have any more patients. We have to keep them on, and thankfully so, because we had so many waves of positivity throughout the pandemic. So we keep them on site, and FEMA does not want to pay for those times that the census was considerably low. So we will have to shoulder those costs. But we are trying our best to get whatever we can out of FEMA to pay for at least the travel nurses.
So aside from everything else, it's basically, it's about maybe close to 4.5 million, and then just possible on receivables.
We have like another grant coming, okay. I forgot about this one, from the FCC for telehealth that we finally get. That should be coming in this week. That's about $722,000. So that's about the last of any of the COVID related grants that we foresee.
It's round up around 5, but we're still considerable. Sure.
Yes.
Okay. Thank you very much, Lillian. This is just an obvious question. I would assume that it's would be standard procedure for any agency or of course, Guam Hospital would be here. Would you anticipate requesting the governor, towards the end of the fiscal year for any possibility of transfer of funds to handle some of the shortfalls?
Absolutely, because right now we recognize that we are the DOC. There's no longer any funding in the account that is specified for taking care of those inmates in the hospital and also keeping the on-site clinics operational. So there is a shortfall of about 2.1 million from June this year to then the end of September. So we've asked the governor for some assistance with that.
Right. So that's, for our budgeting purposes, that there's a little glimmer of hope here. We were able to scratch out close to 9 million, I think, on general funds. So that should be a positive cash flow to you of 6 million outside of, you know, and of course we'll continue to light the candles. But final question, and the reason why, once again, is this is what we're talking about here, and in terms of anticipated lapses or revenues or excess revenues, we know that this is what the governor is going to have to do in the end of the fiscal year, is pay those bills and those operational needs that are outside of, you know, what is budgeted and also what receivables are. So Lillian, last year, and this is for the purposes of how we plan to talk about excess revenues, have you realized any monies for excess revenues of fiscal year 2022?
No, but we are anticipating that that 5 million that was appropriated for the recruitment of specialty doctors, and then the 15 million for our CIP. So we're expecting that.
Okay, and you would not consider that until the audited revenue, right? You
Correct.
Can't count on that, right?
Absolutely.
Yeah, we're just hoping
we can't
that,
spend what we don't have.
yeah,
yet,
we're hoping that all the institutions, you know, following that protocol, otherwise we go into the big D word. But I wanted to make sure we got it on the record here, because, you know, this is for our purposes and how we're budgeting going forward. I'm glad that the agencies, and particularly large agencies like yourself, won't move until those audited revenues are realized, so that you actually know, and the governor knows, that that's cash in the bank and she can give you the green light. Mr. Chairman, that's all I have. Thank you.
Thank you. Moving along. Anyone else, please raise your hand. Madam Speaker.
Thank you, Mr. Chair. Thank you for coming down, CEO Posadas and of course, Yuka. Can you clarify this current revenue is 90.5 million? That's for FY23. This is a cumulative revenue?
Yes, until June. I have the financials until June. July is not completed yet.
And what was your estimate before the last budget of what your revenue would be at this point?
It is less than what we had budgeted. By 10.2 million.
All right. Do you know why?
We have had many challenges this year, particularly with our our IT system, our EHR. We've had many challenges beginning in October when we went live with the EHR. So it's very common when you implement a new system that it's not going to be perfectly working on day one. So we did anticipate for the first 3-6 months, possibly a year, that we would have some challenges with whatever issues come up with the EHR. And what we've realized is that it's affected some of the charges that drop into our bills. So we're having to clean a lot of that up. And then in March, when we went down entirely, we lost a good portion of time to actually submit bills, which we're getting caught up on right now. The staff is working very, very hard to get caught up on the bills so we can get some cash coming in. But it's been a challenging year for us overall.
Yeah, I think during the budget hearing, we discussed that I think you were 100 million worth of billing that was not done or needed to be done, something like that. And I asked you, how are you going to make up for this billing? And you said, oh, we're going to be able to do that in the upcoming fiscal year. And you still believe that's possible?
We're doing it right now, Senator. We have the staff working diligently. I've even authorized overtime for them to really get these claims out the door. We've also detailed others in the other the other areas of billing to come and just work specifically on billing so we can really push them out and get caught up. They're very motivated and I'm very proud of them. And it's materialized to a significant billing production this month. So it's actually looking very good.
All right. I was looking at your projection for FY24 an operating revenues is 124 million. That's like 30 million more than what you're operating this year. And 20 million more than what you estimated, I guess, to operate this for operating revenue in this year. And do you think that's realistic, the 124 million?
Yes. Yes, so this includes projections we made based on our historical census. That's how we do our revenue projection. Plus we added about, I believe, 15 million that we estimated would come in from increased room and board rates. And when we did this figure for the room and board, we realized that we'll be very limited on the Medicare and Medicaid part of it because we're capped. So we did a conservative estimate of what that revenue projection would be, and that's how we came up with the 124.
All right. And so the governor's request was status quo for GMH, but the budget bill that we have before us gives GMH $3 million more in pharmaceuticals funds. That's because of our increased estimate of BPT. It's just a formula, right, that's used in the pharmaceuticals fund. So we increased BPT, and we were able to give GMH 3 million of that, or 3 million more of that, totaling 21 million this year, FY24. And I think your request for that, anyways, the general fund appropriation in this bill is all 4.9, almost $5 million more than last year as well, FY23. Your request was only 3.5, wasn't it? But this goes way beyond that. It goes $5 million beyond that to 8.4. Mr. Chair, I guess if I could just ask you how or why that happened. It exceeds their request by 5 million.
Let me ask OFB to come in here. Can you hold?
Yeah, and in the meantime, so could you just talk to me a little bit more about the billing, Yuka? So you're saying they're working very hard to catch up, but is your system currently working the way it's supposed to I know you converted to a new EHR system, and are you able to bill based on that?
Yes, but with a lot of workarounds. So we are already a good 9 months or so into the new system. And the second part of the implementation of the EHR is actually upgrading or moving to a new system for the patient accounting system, which is the billing and the collection side of it. But until we get to that part of the implementation, we've learned enough in the last few months and working with our IT department and our informatics team on how to actually have a lot of workarounds on the barriers that we've been having with the new implementation. So we're working around a lot of things. I'll admit it's a bit more tedious, but it just needs to get done until we move to the new system on billing.
All right. So you have 30 million in accounts payable, meaning that's what you've billed and unpaid. Do you have a number of unbilled that needs to be billed, or do you not?
Yes, we do. We track that every day. Right now, our unfiled means claims that are ready to go out the door to the insurance, and that is, today it's about 23 million.
All right. And if that goes to the insurance, do you expect payment of 23 or you expect payment of less?
Less. It's usually less. For the insurance companies, of course, they will not pay the portion that is the patient's responsibility. They will not pay claims that are denied or not covered benefits. So that's usually about 20% of the claims we're seeing that come back like that. And then for Medicare and Medicaid, we get capped on the inpatient rate of about $1,500 per day.
But you wouldn't bill Medicaid or Medicare. The 23 doesn't include billing Medicare for what they won't reimburse, right?
It's the gross charges.
Oh.
So yes, that's the gross amount.
I see. Are there any, did you lose out on bills because we weren't able to send the bills out? I mean, like they're too late?
Yes. we
How
have.
much?
I don't have that number right now, but we did lose some just on timely filing. For the local insurance, we only have 90 days to bill from the date the patient is discharged. For Medicaid and Medicare, we have a year. So we do prioritize the 90-day window because that's usually the one that's really the time-sensitive ones.
All right, and that was, did the shutdown impact that amount of bills that you were unable to send out during that period as well?
Yes, it did, yeah.
All right, I'm also very worried because I am also hearing from people that GMH is not paying its bills. We've got vendors that are not happy, that are threatening not to do business with GMH, and that's very concerning. I was even told that, I think it was on some kind of social media, that they're looking for wipes and diapers and things for the nursery because GMH is unable to procure those items. And could you just talk about that, Lillian, and what is going to be the solution to that? I mean, it's obviously you got a shortfall, so what now?
Thank you for that question, Speaker. But really, the basis of that issue is that it clogs up our plumbing system. You know, we have an old hospital, and so when it's used a lot and, you know, flushed down the plumbing system, it clogs it up. So, you know, it really impacts. And so we limited the use of those baby wipes to then just specific areas such as nursery, such as the ICU, telemetry. But, you know, when I was working in the hospital, we didn't have baby wipes.
No, I'm talking about vendors. Are you
paid.
saying you don't have an issue getting supplies right now?
Yes, we do, Speaker. We do have issues with regards to some of the medical supplies. But for that particular situation that you asked with regards to the wipes, I just wanted to give you a little bit more explanation as far as how that started out.
Okay, well, are you able to get the supplies that you need? And I'm asking you, what's the solution if you're not able to pay the vendors and you need supplies from those vendors? What is your solution to this?
We look for other sources of vendors who can provide us those similar types of supplies. And so we work with those different vendors. But there are certain vendors who we have working relationships with, and we regularly order supplies from them. So, but we also have other vendors on island that we can procure some of those supplies.
So you're not having an issue with getting supplies from vendors?
Yes, we do. I said that we have issues with some of them, but the alternate option is as far as what we're doing to address it, is that we go to other vendors.
All right, thank you.
Thank you.
Madam Speaker, I have Steve. And if you can please restate your question so that you can regroup. Just state, and it's not going to count against your time.
I'm just trying to remember what it was.
I think it has to do with the additional funding that was provided.
Oh, yes, yes, yeah. I'm glad GMH is looking at more funding than FY23 for sure, even more in the general fund appropriation than their request. But if you could just explain how you're able to do that.
Yes, Senator. If you look at their budget, as far as the general fund is concerned, I think their request is only for 3.5. When we did the calculation for the GPP, I believe the amount is 8 million. So all we did was to ensure that at least the GPP was funded for, and that's how we came up with the 8 million. The additional, I believe, 4 or 5 million that they got also in the pharmaceutical fund is like you said earlier, it's just the calculation of the BBT that automatically goes to the pharmaceutical fund.
Thank you. I thought the governor said in her request she covered all the the GPP.
You're right, Speaker. She covered all the GPP for the line agencies.
Oh.
And that's why we have an increase in the reserve categories, which did not get a complete funding of the GPP, and that's why we had to increase those amounts in those categories.
All right. Thank you. Thank you very much, Mr. Chair. Thank you. Thank you all.
Thank you. Anyone else like to speak? If not, we will close. No. Okay, Senator Parkinson and then Senator Paris. And you had your hand up? Then you'll be after Senator Paris. Senator Parkinson, please.
Hello today. You previously had a revenue cycle management vendor in working for GMH. In your analysis of your revenue, did that vendor provide a net positive financial impact on GMH?
Yes, it did.
Since that vendor has left, have you seen difficulties in your overall revenue cycle management?
Yes, as far as collections and billing is concerned, but most of that was impacted by the EHR implementation. So the EHR went live in mid-October, and so we already noticed in November the impact of the go live. We ended the contract with the contractor, the consultant, on early November. So there is an overlap of when we ended the contract and when we went live with the EHR. So it's been hard to tell whether or not what that actual impact is. But we do see a improvement definitely in our processes for getting the bills out and everything. It's just been hampered by the difficulties with the EHR.
What did they do for GMH that had a positive financial impact on your bottom line?
They helped us restructure the entire revenue cycle areas within the fiscal department, which includes the patient registration side, medical records, our billing, our follow-up. We created a new revenue integrity section to help capture missing charges, which we had not done before. And then they really helped a lot, mostly with the Medicare claims. So in the past, we didn't have a whole lot of experience, I guess, with Medicare, and we didn't have a lot of billers for Medicare. So we had more of the billers trained on how to do the Medicare billing and to address when those bills would get kicked back to us. So although the claim will shoot over to Medicare, sometimes they get rejected or returned to provider, and we need to correct those bills on time in order to get paid. And now we pay a lot more attention to those.
Okay. You said you have $30 million in billed and unpaid services and $23 million in unbilled services, and an unknown amount that has been lost because insurance was not billed on time. Were those some of the things that the revenue cycle management can help you with? Or is that outside of their scope of work when they were assisting you guys?
No, that was part of what they helped us with as far as training and being more aware of our processes in order to prevent things like that from happening. However, on the issue when we lost our network back in March, we really did lose all ability to send a claim out because we didn't have any network at all. So we did get backlogged for several weeks on the billing, and that's how we got really behind. But we're trying to catch up as much as we can right now.
Do you have a shortage of personnel to work on these collection issues?
Collections are separate from billing. I'm going to say yes. We always could use more people and more resources to help us with getting bills out and collecting on them as well.
Okay, because I asked GMH in May for their monthly revenues and expenditures in the last fiscal year. In FY2020, you had a net loss of $217,885. In FY2021, you had a net loss of $8,458,376. And in FY2022, that loss decreased to $1,858,801. So we see the progressive improvement there. What do you attribute this decrease to?
We did get significant federal funds from FY 2020, 21, and 22 from COVID-related grants. We received a lot of money from the Provider Relief Fund, from FEMA, and also from the American Rescue Plan. That would probably explain a lot of why we were able to make up for shortfalls in any increases in expenses we had to pay for example, for payroll, we had to pay a differential pay, the COVID differential pay, for example, and that was covered by a lot of the federal funding that we received. But of course, when you're going to pay more on personnel, that's going to increase your expenses overall. But underneath, when we get reimbursed by federal grants, that will offset that increase in the expenses.
Because from what I'm looking at here, it seems that we are leaving millions of dollars on the table on these uncollected billings. And so, you know, I have to bring up the point. It seems like it improved significantly when we had a revenue cycle management team on place. I'm not going to bat for any particular vendor here, but do you think it might be a good idea or a prudent idea to potentially go back to a system like that or an arrangement like that? Why don't we consider going back to revenue cycle management vendor?
Because the intent of the contract was not long-term. We really wanted to keep it short-term in order to provide the training for our staff to be able to manage the revenue cycle on our own and not have to rely on a consultant or a third party to do that, because these are really basic processes, I suppose, that we should all learn, that those of us that work in the revenue cycle and hospital billing, where we can do it on our own and not have to rely on a vendor.
Yeah, and you know, I agree with that in-house position of making sure we get people trained to do these very basic things. But I do have to say, I have a little bit of concern if that training is going to potentially lead millions, if not tens of millions of dollars on the table. So while I appreciate the need to get that in-house, if we are having significant amounts of uncollected billings, maybe we should consider going back to a vendored system, at least for a little while longer until we have a little bit more seasoning from our own people. Because I have to say, I have noticed a significant dip from when we were on the vendor to when we were not. So at the very least, it tells me that at least that public-private partnership was working out well. And I mean, I have to think that they weren't collecting this from mom and pop who were pulling it out of their couch cushions. This primarily had to be billings from insurance companies that they were collecting, correct?
Yes. Yes.
Yeah. So really, by getting off of this vendor, we've really just given millions of dollars in uncollected billings to private insurance companies because we decided that we could do better than the vendor and failed to do that. So do I have that correct? That seems what's happened to me.
If I may, Senator, say something. Historically, the hospital has struggled with billing and coding, not just in numbers of personnel, but also in the knowledge and the competency and the training. They were not really trained. They were kind of like put into the position without much of any training, but on the job. And back then, there were only about 2 or 3 billers and coders. We now have 7 coders. We have 12 billers. And most of them are now certified. They've gone through some training, and so they now have skills, more advanced skills in doing the job. So we feel that we're making some progress and making some improvement to rely on our own people to get that job done. And yes, that consultant did a lot of training, and they helped our staff gain more knowledge and experience. And so therefore, I think we can give them that credit to move along rather than expending more again on another, vendor, another consultant. So, if you just give us some time, we will make that progress and that improvement. Thank you.
All right, thank you for that. And I think with that, I yield the rest of my time, Mr. Chair.
Thank you, Senator Parkinson. Senator Paris.
Thank you, Mr. Chair, and good afternoon to Lillian and Yuka. Yeah, I'm all for reducing expenses, and so it looks like you're headed in that direction by bringing things in-house. I think that's a good move. In regards to, so I have some follow-up questions. My colleagues asked a lot of the good questions. So I understand that, you know, how can you basically subsidize the budget for GMH? So we heard that there's federal funding that was used. Is that still available? For instance, there's other federal funds out there, Inflation Reduction Act, Infrastructure Bill. Is ARPA still available to GMH to help subsidize losses?
No,
Okay.
there is.
How about these other federal funds?
The one we're actively pursuing now is the FEMA. Yeah, that's taken a while to materialize, but we believe this fiscal year we'll finally see about $4 million from FEMA.
Okay. And that's using the 90-10, right, share?
Yes, yes.
In regards to other measures to lower expenses, what are some other ones that you have in play or you have in store?
We've been working with our department managers, particularly the exempt employees, that we really need to cut back on overtime. So that we've already started, really scrutinizing the overtime and cutting back on the overtime.
And with the travel nurses, so you mentioned that you still have them on board?
We have about 26 travel nurses from 2 different staffing solution companies that are based in the mainland. And we utilize these travel nurses primarily in the ER, ICU, telemetry, and now we've also have some in the NICU and PICU areas. So those are the priorities.
So they're harder to wean off because these
What was that?
Are they harder to wean off because there's no local nurses that can take these places?
Correct.
Correct?
We've been trying to, you know, decrease our reliance on them, but unfortunately, you know, this nursing shortage is not just local, but it's also nationwide. A lot of the hospitals have closed or have struggled with nursing shortage.
Okay. Is there any attempt to hire them? Are they willing to be hired
And actually,
here?
our nursing administrator and the deputy administrator, they've done some really creative solutions in converting some of these travel nurses that like it here in Guam. So we've moved them from being travel nurses to contractual employees of the hospital. And that has cut the cost tremendously, because what we normally pay is $100 per hour to the agencies. We brought it down to about $38, $40 per hour that we're paying. Okay. So it's a very significant cost reduction for us.
That's great to hear. So the other thing is the budget that you proposed is slightly higher than what we have in the budget bill. Is that going to cause, is that a cause of concern? Because I believe the submittal that we have here was like 23 million, sorry, for personnel. So it's slightly, I believe it's different from what is listed in the budget bill, or is this, are you satisfied with what's in the budget bill?
With what we requested or what the legislature is working on? Because we requested for more. You know, as our CFO, Yuka, mentioned several times, cost of running the hospital has really significantly increased in the pharmaceutical supplies, medical supplies, the human resources alone, and not just with nurses, but with doctors and also allied health professionals. You know, the cost for human resources has definitely gone up. Utilities, we're paying so much more money for our power and our water expenses. And so those are, you know, those have really gone up. And so yes, our fiscal year 24 budget request is definitely much higher.
Okay, the other thing that was mentioned, if I recall, there was some patients that basically they weren't, they could have been placed in a lower intensive facility. To what extent is that impacting the hospital as far as cost? And if we did have a facility to transfer them to, what would be the savings in that?
Yes, thank you for that question. That is definitely a big concern because it is costing the hospital anywhere from $3 million to even $7 million per month. There's approximately an average of 20 individuals in the hospital who do not need to be in the acute care hospital, but because they have nowhere else to go, we keep them there. And so that, you know, they take up those acute care beds when other patients in the emergency room are waiting for it. And when they take up those acute care beds and they don't need to be in that acute care beds, you know, it is costing us. And so, and we're not getting reimbursed for those individuals who occupy those acute care beds. And yes, we are working with the public health to see how we can then have some kind of an agreement to get these individuals into a home where they don't really need to be in a medical facility, but in a home.
Okay, and the other thing that the budget bill has is lump sum appropriation, so you don't have any lapse funds that,
I wish we had lapse funds, we would certainly could use it, but, you know, definitely if we could find some lapse funds.
okay, well, thank you for your answering the questions. Thank you, Mr. Chair.
Thank you, Senator Burr. Senator Tello, you have any questions?
Thank you, Mr. Chair. Good afternoon. With regards to credit agencies, are you still using a credit agency company to collect your the debts owed to GMH?
You mean collection agency?
Yeah,
to
collection
help us?
agency.
No, ma'am, we don't have a collection agency. We used to work with the AG's office to help us, you know, particularly those with self-pay. They were helping us, but not recently. We haven't used.
Okay, so what do you do now? Who oversees that agency at Guam Memorial?
So right now, it's all in-house. It is what we'd like to do as soon as we get our accounts receivable aging report cleaned up. We would like to take those old self-pay accounts that are totally uncollectible and hire a collection agency to go after them.
So the plan is to still hire a collection agency?
Yes.
How many people do you have working in that department?
We have 4 right now.
Only 4?
Only 4.
That's the lowest it's ever been, right? And
I'm
GMH,
not
or
sure.
has it always been 4?
Since I've been there, it's always been 4. Yes.
Okay.
So they mostly entertain, like when the patients come in and have questions on their bill or want to arrange a payment arrangement, they would do that. But we don't have anybody or enough people to actively call every day all the outstanding accounts that are very old. So we would like to just give all that to a collection agency.
And what's the cost of hiring a collection agency? And do you plan on doing it in FY2024?
It really depends. We really wouldn't know until we go out on a bid to get a company to do it. But I think typically from what I've seen, they collect usually, I think, 25 or 30 cents on the dollar, I believe.
Okay. And how much have you paid so that's how, but you don't have an agreement. Okay.
No.
The other one, earlier you mentioned that you were $30 million pretty much in the hole. Of that $30 million, how much of that can be reimbursed through federal funds? Or is that clearly an obligation of the government of Guam to clear up that debt?
The amounts that we owe for the travel nurses, we hope to obtain funding from FEMA, but again, FEMA is really only paying about 50% of the costs that we've already shelled out for the travel nurses since the pandemic.
So 30 million is actually, if you're...
The travel nurse portion, I believe, is about 12 million right now.
Oh, of the 30 million?
Of the 30, yeah.
So you're planning on getting 50% of that 12 million, or is it just 12 million?
No, it won't be 12 million.
Okay, so it'll be 50% of that. So you kind of like take 12 million, if you're only going to get 50%, then you're only going to get 6 million, right? So you take the 30 million and subtract it by 6.
Yeah,
correct?
That would be fair.
So now you're down to about 24.
24 million.
24 million. Okay. Is there anything else on federal funds that's going to lower that debt of 30 million or 24 million now?
There is some on contractors that we've hired to install and work on our HVAC and AHU system, but it will not be more. I'm just estimating about $500,000 to $1 million possibly for that.
So that's 23 million. Now it's nice to know we're going further down on the
and
cost.
then we have the 722 that's actually a reimbursement to us for the telehealth. So that will come straight to us.
So we're down to about 22.3, million, right? Okay, so, I just wanted to know how deep you guys are in debt right now, and are any of these obligations required to be paid up in FY24? That's very In other words, if you don't pay some of these debts, that they won't service the Guam Memorial Hospital.
Yes. However, we have been able to work with the vendors, and instead of paying the whole amount that we owe, they've been very amenable to just partial payments or installment payments, because I think that the vendors really do want to continue serving the hospital. They are concerned because we have patients that we take care of. So if we can make even a small payment, they've actually been very okay with that.
And provide the services that Guam
Yes.
Memorial needs, so we're looking at about 23 million now.
Yes.
Well, I hope we can lower that amount very soon. Thank you, Mr. Chair, and thank you for being here.
Thank you.
Thank you. I'm looking for hands. I don't see any hands. Senator Blas, did you want any final comment? Otherwise, we're going to move. Senator Brown, okay. I'm not going down the line, okay? I'm just, whoever's got their hands up, you ain't got your hands up. We're just going to move so we can close because there's no amendment on this part. Senator Brown?
Thank you, Mr. Chairman. I appreciate GMH coming down here at our short notice request. You know, this issue of collections is an old one, and it continues. I mean, you've had collection agencies in the past, and so that's nothing new. And I just don't know how or if ever GMH is going to get over that hurdle with regards to collections, because that continues to be a problem. When we had your hearing for your budget, GMH, you had relayed that there was $22 million at the time, this was just a few weeks ago, that were owed to vendors. And that obviously I know has been brought up, but it's a bit concerning because does GMH have the money to pay that? Because I'm a bit concerned because we are hearing if vendors are not getting paid, you know, even though, you know, as mentioned, you might be able to get to other vendors, but it just doesn't, you know, give the hospital a good reputation of knowing that, you know, if I'm going to do business with you, I'm going to get compensated in a timely fashion. Do you have the revenue to pay for this debt that's owed?
The cash flow is an issue, and so the short answer is right now, no. We do pay whatever we can, but we don't have, you know, the $30 million sitting around right now to pay off all those vendors, no.
And what's your aging? How old are these obligations here that are owed?
Most of them are actually in the 120-day bucket.
And what type of supplies or materials or whatever that you may have purchased that you're not able to pay for?
So the ones for the travel nurses are quite old. Let me see. We have some pharmaceutical suppliers in that bracket. Some contractors for the alternate care site, which we're waiting for the FEMA funding to come in to reimburse those. Most of it is actually for...
Spent a lot of time in hearing about building a new hospital and all this humongous complex that we wonder how we're going to pay for. And it's bothersome that here and now, where we are at this moment, trying to ensure that the hospital is viable and that you know, patients that go there are going to be able to get the care that they need.
Like I mentioned, we have been working with the vendors and asking if they can take a partial payment instead of the whole payment, and a lot of them have been very amenable to that. As a matter of fact, they really say just move the account, just make some kind of payment. It doesn't have to be the whole thing, but just keep the account moving, and they've been able to supply us with what we need.
Yes. That's nice, but we hear that, you know, from people that work at the hospital that that's a challenge, is getting the supplies they need to operate, and that's concerning. This is not a new story. Nothing's changed. I mean, this is the age of our governor who's the nurse, and the hospital and healthcare was supposed to be a priority, and we're hearing other things in the insurance that's sinking. I'm sure the legislature will be looking into, you know, this decision somehow that we're going to self-insure. That's another day, of course, Mr. Chair, but this issue, again, another perennial issue that has not improved, and I don't know how we talk about bigger things and funding other things when we can't take care of the basic things that are needed at the hospital, that your personnel need to operate safely. And also, again, I'm sure for those of you, and certainly Lillian, you've been in healthcare for so many years, I'm sure you want to see that your patients are taken care of, but this, you know, just making it by and having vendor payables that are this large and for that length of time is very concerning. I mean, if we can't take care of that, how are we ever going to get to the next level?
If I may comment on it. Senator, despite the challenges that we have with regards to supplies and all that, the staff have been just very, very committed, and they really do provide the care. So it's not that they don't take care of the patients, they do. In fact, we get feedback from patients that they get excellent care. And yes, we are challenged with the supplies, but as Yuka said, we work with the vendors. And yes, they are very accommodating and amenable when we make some kind of payment. So yes, we continue to keep the hospital open and operational as best we can. But yes, this is why we come here to then ask for your assistance and support. Thank you.
Well, I understand that, but at the same time, in managing the hospital, I mean, has the administration come forth with any assistance of helping the hospital with regards to your vendor payables that are this large? And then what are you going to anticipate in the next fiscal year? Are we going to go down the same road again?
We continue to do our best to do the collections, but again, the other challenge is then the health insurance. We are challenged for them to then pay us 100%. We don't get 100% reimbursement of the claims that we submit to them. So we work with them on a very regular basis. We contact them, and I tell them, yes, I'm pestering you, but that's my job, is to pester you so you can pay us, reimburse us for what we provide the services to your members and to your subscribers. We continue to do that. And yes, to your comment or to your question with regards to the governor, she does assist us, because I call her up and I ask for help, and she does respond. She supports us.
And what other areas? Is there any other area you're not current in besides vendor payments?
What's that? Oh, go ahead, procurement.
Not current with, I'm sorry.
I know you mentioned your travel nurses that you're owed, and yet you did mention during the public hearing that you're, you know, as you get reimbursed with your federal funds, there are these things you're going to offset with federal funding. But is there anything else that you would consider a significant category that you're behind in payment?
No.
Everything else is current, retirement payments, everything else for your people are current?
Yes.
I guess, again, I think we need to recognize this as a challenge, Mr. Chair, because, again, I find it difficult to talk about, you know, a nice, beautiful building. You know, I know GMH is old, but this building is older. Some of us are older than GMH. But, you know, with regards to health care, if we can't provide that now and provide that comfort level now at a time when, you know, there's all this bragging that we have an additional $100 million this year, and yet Guam Memorial Hospital still in the same situation it's been forever. This is an old story. Collections is an old story. Vendor payments not being paid is an old story. And I think it's very concerning. I just don't think everything where we had higher expectations for the overall management of GMH with regards to these issues being addressed, we're still in the same situation. It doesn't change. You know, and I'm sure, you know, our head of our hospital is trying to make every effort, but, you know, the structure's still the same. It's the same. The outcome is still the same, and it isn't any better. So, you know, it's something to look at, because I noticed also in your budget in the pharmaceutical fund, you had indicated you're expecting over 30+ million. And the information that's been provided is maybe we're averaging about 19 million a year. How did you propose that amount if that's not what the numbers are showing? That's a big gap. It's going to be a considerable shortfall. But that's what GMH put in their budget presentation to the legislature.
We actually showed the shortfall, and so we were actually asking for the 42.2 million, but, you know, thank you, though, that you're giving us 30-some million. So it's close to it, but, you know, we would appreciate if we get what we request with our shortfall.
I understand, but the source of what funds the pharmaceutical fund's a little different from additional funds from the legislature, but that was the figure that the GMH provided, that you anticipated that amount of revenue in that fund. Do you recall that?
Can you say that question
On
again?
your presentation for your budget, you indicated 30+ million in the pharmaceutical fund. Mm-hmm. You know, I reading that would get the impression that that's what you're assuming you're going to get, and we did question at that time your anticipation of 30+, I think it was closer to 33 million, when, you know, the tracking is only showing about 19 million.
Right, but previously we were also getting subsidy from the legislature, from the pharmaceutical funds. About 30 million is what we were getting before.
In my last 20 seconds, if I can ask your Office of Finance, what are they tracking now currently? I don't know that it's changed in a couple of weeks, but at least for the record, for edification of the public that's watching, if you can give us your review of what you anticipate this upcoming fiscal year on that fund.
Yes, Senator. Again, just remember that the pharmaceutical fund is based on the business privilege tax. So whatever amount we estimate for the business privilege tax, we take 6.19% of that, and that's automatically dumped into the pharmaceutical fund. This year, we did increase the BBT, I believe, about $35 million, so therefore that represented the $3-4 million that they're getting in the pharmaceutical fund. You're right. Over the last several years, it's been averaging around 17 to 19 million a year. But if you notice this year, they're getting almost 22 million, and that's as a result of the increase in the BBT directly. The additional 8 million that we're giving them in the general fund is a subsidy to them on top of the pharmaceutical fund. I believe the question was asked, how did GMH come up with the 33 million for pharmaceutical fund? That I have no idea how that number came about, but maybe like Mrs. Posada said that in the past they've been getting maybe a subsidy. I believe not so much from the pharmaceutical fund, but maybe a combination of both pharmaceutical and general fund subsidy, because again, like I said, the pharmaceutical fund is based only on what the BBT tracks.
Well, thank you. I appreciate it. Thank you very much to GMH for being here this afternoon. Thank you, Mr. Chairman.
Thank you, Senator Brown. Senator Blas, and then we're going to close it up on this part one of Chapter 3.
Well, thank you very much, Mr. Chair, and ma'am. Thank you very much again for being here. Just to summarize, wrap things up. First off, with regards to your vendor payments, and you said you're about 120 days out. Okay, and is GMH subject to the Prompt Payment Act? Are you subject to the Prompt Payment Act? Prompt Payment Act was basically
I'm sure we are.
12%. Is that factored into the $30 million that you?
No, it is not.
So you can easily say that there's about 30, anything basically above 90. Well, let's be safe. Let me give you some conservatism here. Anything above 90 days, you're going to have to add 12% to that. Oops. Okay. And then, I'm sure that, prior to the typhoon, you were doing some assessment with regards to what the repairs and everything that's necessary for the hospital. What was that number? What was that figure, and as far as what your costs were for your needed, I guess, improvements, repairs prior to Typhoon Mawar?
Probably for the CIPs?
Yes.
I'm just taking a guess, but it feels like it was around 30 million.
30 million? Yeah, because
Yeah.
that's around the number that
Army
I remember.
Corps. The
I just
Army
wanted to-
Corps.
And so now with Marwar, okay, what other damages do you have in as far as costs?
The chillers, the two chillers, 450-ton chillers, and a smaller one, that's already pretty much tagged at 12 million that we need to replace. And so we're pursuing some
Okay.
FEMA funding for that.
But even at that, we know that as far as FEMA funding, okay, from my understanding,
Takes a while.
it's right now 90-10, right?
Yeah.
I think it's 90-10 now, if I remember correctly. But even at that, we need to pay it up front first.
Correct.
Yes.
Yes, we do.
Do we have that ability to be able to do that?
Of course not.
Okay.
I'll be honest with you.
No, I appreciate. And ma'am, this is why I wanted you here. Okay, is to basically recognize. Okay, we've got needs that we need to take care of.
Yes.
Okay, and I appreciate. First off, last question, and this goes to Steve. Steve, just to summarize, what was the administration's proposal in this budget for GMH total, both pharmaceutical and general fund? What was the administration's numbers that they gave to you?
Give me a few seconds, I'll get it from my analyst.
Status quo.
That's cool.
Just the same from 23, both the pharmaceutical and general fund? No, what's the 24 level? Okay.
What was their budget submission?
Pardon?
Their budget submission, when they submitted the budget to you?
That's why I'm trying to get it from her. Okay, Senator, for the general fund, it's 3.5, and then for the pharmaceutical fund, it's 19.9, is what the request was.
Okay. And
With the
what was
governor.
the OFB, and what are we considering?
What we're recommending in the bill is approximately 21.7 in the pharmaceutical fund and 8.5 for the general fund.
So that's basically an increase of about 9 mil? 10?
About 8 million, 9 million, yes, Senator.
9 million more than what the administration was requesting for?
8.
8 million more?
Yes.
So we're giving 8 million more than what the administration is requesting for, yet we have administrations in front of us here saying that, they got a lot of money. They need a lot of money. I just wanted to make sure that it's known, okay? We're trying to be able to provide them the funding, okay, as a body. And I appreciate the work of your office, okay? And, Ms. Posadas, we'll see if we can find them, okay? Thank you very much. Thank you very much, Mr. Chair.
Thank you, Senator Blas. The oversight chair of GMH would like to make comment, and then we'll wrap it. The oversight speaker.
Thank you.
Well, and also Senator Lawrence.
Go ahead. We're on round 2, right, Mr. Chair?
No. This is actually it's over already. But Senator Lawrence advised me that he raised his hand, but I didn't see him over another senator. But no, because she's only going to make comment to GMH because she's the oversight chair of GMH.
Okay.
So I wanted to give her that respect. And Senator Blas started it with the beginning.
Okay, so you want me to go first?
You want to ask the question?
Sure, yes.
Okay, we'll
I
keep it
understand.
short
Yeah.
so we can
Yes, I will.
close this real
Got my
quick.
5 minutes, right?
I'll be
Yeah,
like-
thank you.
Maybe I'll reduce it to 1, but go ahead, Senator Lawrence.
Thank you, Mr. Chairman. Good afternoon, Ms. Rapadas, of course, and Ms. Hechanova. Thank you for being here this afternoon. I'd be remiss if I really didn't ask this question. I got to go on. Basically, this would be a question or comment for another time, but based on the fact that we haven't been briefed and know nothing about basically the self-insurance, but based on what our caucus leader had asked and expressed some concerns, have you been briefed about the self-insurance? Have you been briefed in the context on the I guess how his self-insurance is going to be worked out and all that?
You're asking me, Senator?
I don't know. I was asking Ms. Posadas.
We've had some discussions with the governor about it and Mr. Edburn, and briefly, in a nutshell, I think it's going to be more advantageous for the hospital because the collection of the premiums will go into a government of Guam account, and then whenever a patient is admitted into the hospital, that claim will go directly to the TPA, which is going to be Calvos, and then we will get reimbursed in a quicker manner, is what I understand with that self-insurance. So really,
and the reason I was asking this is because, at least you're getting your briefing. We don't know the context of this, and so these are all based on what we hear in the media, and of course, we're reacting to some doctors who are out there already saying that they're not going to take any more new patients based on government of Guam self-insurance at this point. And my concern is that if we have that fact that some doctors won't be accepting Guam self-insurance plan, that you're definitely going to see an increase. You already have it now. You're definitely going to see an increase in your primary care, be it, again, you know, your emergency room is going to be primary care, basically, if doctors don't take new patients. Likewise for maybe OB-GYN situations and all that. Based on the briefings and based on maybe situations where doctors are not going to now accept that, have you calculated maybe what your primary care emergency room expense is going to be, and how much that's going to rise, and maybe your uncollectibles, how much would that add to the till? Have you guys calculated that at this point?
No, we haven't had time to do that calculation, and maybe that is something that we can then work on to have some projected.
Okay, but it's obvious
costs.
that it's obvious if doctors won't accept it, that you will see a rise in your primary care. Basically, your emergency room will be primary care for a lot of folks, and probably won't even pay their bill.
Well,
it's a great possibility, right?
We won't know, but yeah, until it happens, and so.
Great. Thank you very much, Ms. Chair. Thank you.
Thank you. All right, we're good. Madam Speaker, Oversight Chair of GMH.
Thank you, Mr.
Quick
Chair.
comments so that we can wrap this one up.
I just want to confirm again. So there's a $30 million accounts payable, meaning owed to GMH. So you sent out bills waiting for collection on that. But there's 22 million unfiled claims, meaning need to send bills out on that, and you're working on that, you said. But this 22 million owed to vendors, is that the correct number, 22 million?
The accounts payable in total right now is 30 million.
Oh, you mean you owe 30 million?
We owe 30,
Oh,
yes.
okay. Oh, what about accounts receivable?
Our receivables net is around 50 million.
All right. Okay, then that's even worse than I thought. Yeah, so the 30 million accounts payable, I'm very concerned about that. I feel like GMH was doing so well for a while there. Every time I had asked, they said they were doing well with their collections. They had no issues. When I had asked about, this was a couple years ago only, right? And now we've come to this part of unable to pay our bills. But what I'm just very, very concerned about, and I feel like it's an emergency situation to be, for our hospital to be owing vendors, and the vendors, it's impacting their willingness to provide supplies to the hospital, or your ability to get supplies from these particular vendors and right now and going forward. Have you asked for any kind of transfer to the hospital to help the situation, to pay these vendors? Like a transfer authority from the governor or anything like that? Any other emergency way to pay this off?
In our meeting a couple of days ago with the governor, we mentioned to her about the DOC, that there are no more funding that was appropriated for DOC to pay GMH for the services that we provide for the inmates when they come into the inpatient area, and to continue the operation of the clinic. And so she's going to be looking at the end of the fiscal year for some lapse funds to then reimburse GMH, for DOC to reimburse GMH.
But that's only about 2 million.
2.1 million, correct. And she has also given us some funding last month, about $6 million to then help pay some of the vendors, including GPA, some pharmaceutical vendors. And so she has been providing us with the assistance.
What kind of funds are those? What do you mean?
Because we are anticipating some funding from FEMA for the travel nurses. And so in anticipation of that $6 million, she was then able to get some funding from another source, so that when we do get reimbursed from FEMA, we will then pay back that funding source.
All right. So I am just very concerned about this. I feel like this puts us back to, I remember when I first became a senator, this was the hot issue at the time, that they were unable to pay their vendors. It was it grew and grew and grew, and I'm so afraid that that's what's going to happen if we can't get a handle on it. Like right now, well, I don't even know if I'm going to say this is a manageable level or not, but it does seem very alarming to me, Mr. Chair. And so I'm glad that GMH got some additional money over the status quo from FY23, but if that goes almost all to the GPP, the pay raises, then it doesn't really give them any additional amounts to deal with their payables or to get increase a number of billers or to make any of those changes that they might need to do to catch up in this situation with sending out the bills. So I'm not sure what the solution is, and I guess I don't know I don't know what else to say except, yeah, I mean.
If I may, Madam Speaker, so what's happening, like what we mentioned before in the mainland and in hospitals across the country, they are actually shutting down and closing services. So they'll maybe close down their pediatric ward and they just won't provide those services anymore. We don't have that option. We have to stay open. We can't close our peds ward and not take any more pregnant mothers or close the ER, but we're, in our research, many hospitals are closing their doors, just running the ER, just running their surgeries, just running clinics because they don't have the resources to keep it open. And we don't have a choice, we have to. So that's why we're really struggling right now with, and it's really just this year, in the prior years, we had the luxury really of having a lot of federal funding from COVID that really addressed all of the expenses that were coming down. Now the funding has run out, the expenses are still there, if not even higher than before, and we're losing nurses, the doctors need to be paid more, it's really becoming a challenge. We need nurses.
And we need billing. We need
Oh,
billing,
yeah.
we need the billing to really work.
Yes.
And, all right. That's my concern, and I'm concerned that if the whole government, again, is not responding to this, we're going to have, I think we have a crisis. When you have vendors not responding to the hospital, that's a crisis. And it puts us to do all this kind of, a roundabout ways of getting maybe less than your optimal product that you have been getting in the past. And I don't want to see that for us. So I just hope if you meet with the governor again or whatever happens that that they look at other funding. Thank you, Mr. Chair.
Thank you. With that, we will close. One more.
Just one question.
Okay.
MedHealth, did you pay them off? Pay them in full already? MedHealth? MedHealth. Yeah, your consultant did.
MedHealth is the.
Yes.
Was it Madhouse or
Yes.
what? But okay.
You paid them in full already?
They sent us an invoice, but remember we ended the contract on November 3rd.
So that's part of your.
They billed us for the month of November, so we need to negotiate with them because we ended the contract November 3rd.
Right,
They're
right.
billing us for the whole month of November, which we don't think is appropriate. So we're going to try and work out whether it's prorated. And then there's also September and October that they invoiced us that we haven't paid.
Okay. Thank you.
Thank you, Senator Blas. We'll now close this part 2 of chapter 3. Correction, Lauren, this part 1. Excuse me, part 1 of chapter 3. And we'll thank the folks from GMH for being here. We'll take a short 5 minutes. And the reason why is because there are some documents that the author of the amendments for part 2, we want to get it all out so everybody has in their hand, they get to read it, and then when we start, we only have 2 amendments, but we have some information that's being passed out. Okay? Thank you. Thank you, Mr. Posadas and Ms. OPA. Committee Hall is called back to order. I asked all my colleagues, all floor amendments must be submitted before that section or part of the section starts. So far, we're running okay. Floor amendments will be distributed just before the section or part of the section begins. Only amendments to the amendment will be accepted during the discussion of that section and part. So we've been doing pretty good. We're moving along. At this point, I'd ask all the amendment has been passed out, if I'm correct, and the information that the author of the amendments wanted to present. I will ask Speaker Terlai to go ahead and begin with whichever amendment she chooses to begin with. She's got two. So you pick which one, or if we want to talk about the information you passed out, whichever one you choose.
Thank you, Mr. Chair. Yeah, I'm going to just talk about the budget overall. So
All right.
I want to thank OFB because it looks like OFB, I think, gave them definitely more, well, the Healthy Futures Fund is an issue. The Healthy Futures Fund is $7 million less than FY23 for public health. So that's huge. 7 million off the bat because the Healthy Futures Fund prediction is so low. But OFB went about 15 million over the FY23 in the general fund revenues here. So I think that's to make up for this loss of 7 million in the Healthy Futures and to account for the 58 that the governor had requested. She requested 8 million more, and I'm sure that's to cover the GPP, right? The pay plan. So it looks like, you know, we're giving them an increase, but if you consider the pay plans, it's not that big of an increase. And we know that when they came in on their budget hearing, it was one of those shows of, they actually came in with a request, or they had sent to OFB a request lower than the governor's request. And we asked them why, and they claimed it, I guess it was an error. And so, but it looks like, but they also, in that budget hearing, came in with, we need supplemental requests. We need to exceed the budget that the governor requested for public health, they said, by what was it? What's their total shortfall that they're saying? 5 plus 1.4? 3 divisions. One they claimed was, their supplemental request was $8.5 million. So they want above these levels that we're looking at in our bill, they want $8.5 million. So I passed out the letter that shows where they claim they're short $8.5 million. But as we know, we're giving them, for the most part, a lump sum budget for them to determine where they're going to be short, apparently, $8.5 million. But they have decided that they are short in the one that really concerns me is in the Division of Children's Wellness. And then they list the things that they claim if we give them this amount in the budget, they're not going to fund, which is the CPS positions that we've been after them for maybe 2 years now, or maybe 3 years, to hire. They claim they will not be able to hire those 4 additional CPS positions. And then they claim they will not be able to pay 6 months of foster care payments. These are the payments to the foster parents. That's where they want to say they're short. They say they're short on the court-ordered reimbursements to foster families and the foster care health insurance payments. And of course, I'm alarmed by this. I feel like we should fund them, of course, to cover all of these. These are all legitimate. So are the ones in the senior citizens category. So are the one under the Division of Public Health. But I just want to point out, because this happened a couple years ago where we fund them in a lump sum. They went out to the media and said, we're short in senior citizens. The legislature did not fund the senior citizens. And we all know we gave them a lump sum budget, and it's up to them to decide where they're going to prioritize. And in this case, we're giving them more than the governor requested. We're giving them more than FY23. I would like to give them more, Mr. Chair. So if OFB can help us with that, I would like to do that. Otherwise, I'll get to my amendments now. My first amendment is to add a new section 17 of Part 2. This is where I want to allocate what the Division of Children's Wellness claims to need, that it be allocated to them. And if we do this, of course it's going to give the other divisions far less. But otherwise, they're going to give the Division of Children's Wellness, the Department of Public Health seems to have decided that they're going to give the Division of Children's Wellness far less. So we're caught between a rock and a hard place here, to say the least, and I want to make sure that they look other places to cut. If they need to cut, or they come in, you know, with the governor, united with the governor as to requesting more, because this is a lot more again than what the governor had requested. So I'm just trying to figure out why she didn't think they needed to cover these things, and they do. There's a big gap here. So that's my amendment. It's really just to set the amount changes because I'm adding in the amount in their letter that the Division of Children's Wellness needs to cover those critical items, which is the 4 additional CPS workers, the foster care maintenance, foster care health insurance. Critical. We probably need more than that because of the increasing foster children situation that we come into every year. But this is what will cover those things, and so I'm making this amendment to allocate it. I know that public. Anyways, that's my amendment, Mr. Chair.
Thank you, Speaker. Does anyone like to speak to that? If not, I'll ask OB, Senator Tello. I was going to ask OB to speak to that because we're trying to figure out how we can assist the agency. And because we put more money in, and we're really hoping that the department itself will figure it out by getting a lump sum. But make sure that the divisions are helped.
Mr. Chair, if you can, just please let us know what number amendment we're on.
Oh, we're on the, gosh, the amendment number would be.
Because one is verbiage and the other looks like numbers, so.
Right, it's the one with numbers that reflect the program authorization for Division of Children's Wellness.
Thank you, Mr. Chairman.
Steve, if you can comment, please, so we can, because whenever we're going to move money, we need to be able to understand where the impact and how we're going to adjust it. If it needs to be adjusted here. If it don't need to be adjusted, then we walk away. We're good. Let the agency figure it out. But Steve, if you can comment to that.
Thank you, Senator.
You're welcome.
Again, the Speaker is right. We did give the public health an increase, specifically a little bit more than $8 million increase over FY23. One of the beauties about giving, especially large departments, a lump sum, because it gives them the ability to, and the flexibility to use this money based on their critical needs as they go through the year. Again, yes, it'd be nice to give all these departments the funding level that they're requesting to satisfy all their requirements, all their mandates, et cetera, but again, unfortunately, that's not the case. And what we've allocated here in the budget is an allocation we thought was fair based on the ceiling that we set for them. But again, we didn't lock them in specifically to these programs, but we gave them the flexibility to use the funds that they have at their disposal in a manner they feel is a priority to them. So again, this proposal is an allocation. It doesn't change their bottom line, but it just now specifically allocates a certain amount of dollars that they would have had to use for other things specifically now for this program.
Okay, now Senator Tello, did you have questions you'd like to pose? You've got 5 minutes, ma'am, based on the amendment.
Thank you, Mr. Chair. Mr. Chair, can you please, Steve, last year, can you tell me in the FY23 budget, how much did we allocate toward the Division of Children's Welfare?
Yes. If you give me a second, Senator, I'll get that information. Okay, Senator, in FY23, right? In FY23, there was no specific program entitled Child Wellness. What we did was a combination of programs like foster care payments, things like that, that we allocated funds to. In this year, in FY24, we are basically creating, at the request of the agency, to come up with a program entitled Child Wellness Program.
Well, it's kind of hard to determine whether this is sufficient enough, especially for the children in, under this program. And even myself, that's why I'm asking you, Steve, what it was given to them last year, because in FY23, I'm looking at the budget bill, and I don't see it here anywhere. So what was the amount that they requested for to be allocated?
The balance, I mean, the amount that requested would have been $5,041,000.
$5 million, and you've
Yes.
only appropriated how much?
We gave them a $1 million increase in FY2024 budget.
You said you gave them a $1 million increase, but
Over FY23 level.
yeah, but I don't see it
I mean,
here.
of their request, I'm sorry, of their request, $1 million more of the request.
Okay, so they basically told you what they spent for this Division of Children's Wellness was $5 million in FY23? Is how much they've spent in that area?
Not necessarily spent, Senator, is what was actually appropriated and allocated for them for the program.
That's what I don't understand. If it was appropriated or well, allocated, it's not in the FY23 budget. It's nowhere in the FY23 budget to determine what they requested for in FY23 to get to an increase of 1 million. Then it would have to show here 5 million was appropriated to them, or not appropriated, but allocated to them. And
Again, Senator, in FY23, there is no program called Child Wellness Program. It's being created in FY24. But
Okay.
the programs that comprise of the Child Wellness Program are like foster care, programs like that are being funded in FY23. So that amount, when we summed it up, was 5 million. We're giving them $1 million more for this Child Wellness Program that now includes all those programs that are existent in FY23.
Does that also include the foster, since you talked about foster health insurance premiums for foster children?
I'm sorry, can you repeat the question?
Does that also include, you said that it was all lump sum, you know, you have the foster care home, you have, you know, children's wellness is all lump summed into one. Does that include the health insurance premiums for foster children?
We have separate provisions in the law, Senator. For example,
But does it include it? That's all I'm asking.
I'm sorry?
Does it include in that $6 million that you allocated,
This is on top.
does that include the foster care insurance?
No, it's on top, Senator.
Okay, it's on top of that.
Yes,
Okay.
ma'am.
When you say allocated, and if this changes, does that mean that public health is obligated to set aside the $15,787,873?
In the wording of the law, Senator, if they use the word shall, then that means yes, it is allocated. If they use the word may, it's really up to them to figure out whether or not they want to fund it up to the level.
Well, this one says shall be allocated and authorized. So that means they're going to tie up the full 15,787,873.
That's correct.
Last question. Did they, again, can you just reiterate what you said about how much they spent in FY23 or they set aside for all these programs to date?
Senator, for FY23, the authorized level is about
Not the authorized level, what they're telling OFB, what they've spent so far in FY23.
I don't have that information, but I can get it for you.
Well, I think it's important that we get it because I don't want to shortchange the children, especially those who are most vulnerable. I mean, you should have asked them how much of you've already allocated for all these combined together to get a true figure instead of just coming up with $6 million. That's what I'm asking, you know, and because it's not in the FY23 budget, you know, it's kind of hard for us to see. So can you get that number, Steve? Find out how much they have already, you know, not appropriated, but spent in the combined children's wellness program.
We can get the information, Senator, but you also notice in the FY24 budget, we gave them a substantial increase. So from basically $5 million.
Yeah, but you know, there's one thing saying you give them an increase, but the reality is how much did they really spend? How much did they really need to cover these children?
Again, Senator, if we went on the premise of appropriating what departments spend, we wouldn't have enough money to allocate.
I know you can't spend, Steve, the only way
the legislature can control the expenditure is through the appropriation.
Right, but you can't say that, Steve, that, you know.
If I may continue, is that the legislature can control the expenditure of the agencies, but given budget tools like lump sum, governor's transfer, they are allowed to spend beyond the appropriation set by the legislature, utilizing these budget tools. But if we were just to outright appropriate X amount of dollars for all these departments based on their expenditures, Senator, we wouldn't have enough resources to allocate accordingly. And this is the whole premise of public health. They're coming in here now telling us we are short $8 million of what we already gave them. So I'm not saying it's not important, but right now we don't have the resources to allocate an additional $8 million to give public health, but they do have the resources to utilize the lump sum provision, the governor's transfer, to reach those levels of expectations. That's what I'm saying.
Well, what I'm saying, Steve, is how can an agency, if this legislature says that this agency is going to get, let's say, for an example, $1 million, how can they spend $2 million? So my question again is, how much have they spent or allocated for this children's wellness?
I can tell you how much they've allocated based on the law. I would need to get back to you to tell you how much they've spent to date.
Yeah.
And what we're appropriating in the FY24, Senator, is the amount they're requesting. So I'm sure, at least to some degree, that the amount they're requesting is going to be sufficient to cover their costs, projected costs for the program.
I've learned in the many years I've been here that you just don't assume something like that. Sometimes they're given other directions, and failed at other areas, and that means, you know, they have their own little pet projects, but something that is more important to this body who feels more important, that it should be paid for in full, and especially something like this with the Children's Wellness Division. So I appreciate you finding out exactly how much they've spent to date and how short they are to cover the remaining expenses needed for these programs.
You know, Senator, as much as I agree with your comment, we also got to take into account that every single department and agency's budget is governed based on their requests. And if their request is an amount that is submitted to the legislature to seek appropriate funding, then I, for one, have been doing this for a long time, would assume that that amount is sufficient to cover their costs.
Well, and we also know, Steve, that that's not always the case.
Absolutely. But the thing is, Senator, that's why we have all these other provisions, budget tools to utilize to help these departments and agencies that, to some degree, are underfunded.
You know how many people come to us that are not directors or deputy directors who actually work in the trenches of these departments and agencies, who come to us to tell them how short they are and that they have no voice, that this is what the director wanted? And the issues that they entail, I mean, we get more information from those who work in these departments than we do from directors who provide these budgets. So all I'm asking right now, Steve, is just to find out how much they've spent in these departments for the wellness, children's wellness, and how much they're short, not being able to fulfill their obligations to help these children.
I will find that out for you, Senator.
Thank you.
Thank you, Senator Tello. I'm looking for, I thought I saw hands here. I'm not too sure. On the left, none. Anybody else would like to speak to the amendment other than the request for information? Senator Dueñas.
I think I know the answer, but I just want to make it clear with Steve. Obviously, you know, locking it up, they'll determine what their flexibility is there. But this remains a balanced budget, correct, in terms of the overall appropriation?
As the bill is presented, yes, Senator, it is a balanced budget.
Thank you, Mr. Chair.
Anyone else would like to speak to this amendment? Senator
Thank you, Mr.
Barnett.
Chair. I commend the author of this amendment. It's great. I don't want to be blamed as the author had mentioned a couple of years ago. I remember Department of Public Health and Social Services had come out and thrown the legislature under the bus because they said the legislature didn't give enough money to do this, do that. And while I'm all for the flexibility of a lump sum budget, if they're going to take that flexibility and use it to bend over backwards and not put money where it needs to go, then if we have to hold their hand and lock up money to make sure it goes to important things like foster care, maintenance payments, this is so crucial. And I'm offended on behalf of all the foster kids and the foster parents that they would put this on the chopping block. So totally in support of this amendment, and commend the author of it for doing your due diligence. That's all, Mr. Chair. Thank you.
Thank you, Senator Barnett. Do I see any other hands to discuss on comments to the amendment? There being none, I know you're still waiting. You want to get to that before we, it's just for information purposes, right?
Mr. Chair, I assume you're talking to me, right?
Yes, ma'am. Yes, Senator.
No, I mean, it makes a big difference because we're going from 6 million and moving it up to 15 million. And there needs to be some justification, you know, with regards to this and why it's been increased. So I think everybody needs to know that. And also, just for the record, Mr. Chair, this does not, you know, use excess revenue, or this is just an allocation. This doesn't touch the budget. The budget still stays intact. It's just an allocation.
Yes, it's an identifying of their total budget. 15 million will go to this area.
Right,
period.
exactly. Okay. And it's unlike in FY23,
they didn't
you know, it's a combination of all these wellness, children's wellness programs put together. That's why it's not in the FY23. So it's
That's
just
correct.
a combination. So
Okay.
that amount of money is quite substantial. Thank you.
Okay, Mr. Guerrero, is there any way you can get that information quickly, if possible, or did they get it ready?
I'm waiting for the financial officer for public health to respond to the question we asked.
No, would you see in the S for it? No.
But, you know, the thing too, you know, going back is that the amount that we appropriate in the FY24 budget is the same amount plus $1 million more. If they're coming down to the legislature and saying that amount is insufficient, then that's beyond the initial budget request they submitted to us. And that's why I'm saying, as we work with the agencies during the budget hearings, they will come down and they will reveal all these other things that they need, and every department does so. But in reality, we try to address them. Some of them we address, some we don't, simply because of the restricted funds that we have available to appropriate. So, you know, and that's why we go through this process. We can't address every single thing that departments are asking. They are important, they are vital, they are critical, but there's no way we can address them. The only way we can address them is you bump up the revenues. Again, that's like, nobody wants to do that right now. We've already pumped it up almost $100 million over FY23. So again, you know, those are just issues that I want to bring again to the body and just say, OOB is taking these things seriously, but we're also restricted in how we can appropriate for these issues and these wants and needs. And, you know, we will do our best as we move forward.
Mr. Chair?
I think he's got the answer now. They just got a response.
Mr. Chair, there was a
Yes.
letter that I was just made aware of just now, and it actually shows with the short, I
Right.
didn't have a chance to look at this before speaking, but it's obvious here that they are short quite a bit.
That's what they're claiming now, but let Steve answer it, because he's got a response from their financial officer. Okay?
Okay, based on the FY23 appropriation, they appropriated $9.2 million for these programs. Of the $9.2 million, they have expended $7 million, and they also have $983 million in encumbrances. So it's safe to say that they've already spent or encumbered $8 million of $9.2 million appropriation.
So I thought you said they got an increase of, only 1 million.
No. What he was reporting is, remember you asked, in 23, what was spent? That's what he's reporting, what he can see from them. Not the 24, 23 only.
And this is something I believe public health is utilizing in terms of meeting program requirements. The original appropriation they loaded in the AS400 totaled $2.7 million. What they did in terms of budget adjustment, they added in another $6.5 million to come up with $9.2 million. So they are appropriating, at least based on what I'm seeing, sufficient funds to cover the cost of the program. Where they're getting these extra funds, I don't know, but that's the beauty of allowing them to utilize the lump sum concept and move these monies to area where they feel is critical and a priority in how they spend.
Or not do it too, as well.
Well, in this case, they are, because they are actually loading up $6.5 million more than what was originally appropriated of the 2.7.
So Steve, you're familiar with the printout that was given to us from Public Health, from Arts and Augustine, showing that in Table 5, Division, can you look at that, please? Division of Children's Wellness, and the shortfall. So you add on, in FY23, what was spent, right? And this is their shortfall of $5,309,823.
What I'm seeing here in Table 5 is, if this is a shortfall, I'm assuming this is a list of their shortfalls.
Yeah.
It's showing a total shortfall of $5.3 million.
Yeah.
What we've allocated, I believe, for FY23 in combined is 2024. Yeah, 2024 is 7.2 million. So if their total expenditures is 5.3 or the shortfall is 5.3.
The shortfall.
Yeah.
Yeah.
I need to find out exactly what their current expenditure is and
Right, that's
compare
what I
that to
asked.
the shortfall.
Yeah, and that's what I asked. What would the current expenditure for FY23?
And I just told you.
Yeah, so then even with that, they're still short, 5.3 million.
It wouldn't be the 5.3, Senator, because like I said, we appropriate, the appropriation is 5 million in 23. We gave them $1 million more in 24. So it'd be up to 6 million. They would have 6 million disposed for this program. Based on their current projected shortfall, if they're saying they're going to need a total of 9 million, of course the 9 and the 6 will be a shortfall of 3. But this is where, again, they can utilize their lump sum concept of moving these monies around to address these shortfalls like they do every year.
So 2023, they had spent so far to date.
Yes.
I'm sorry, can you repeat that amount?
7 million.
7 million.
Yes.
And even in that 7 million, okay, they were still short based on what they provided us here, 5,309,000. So that's about.
Okay.
And that just covers, you know, necessities. I mean, it's just like 2 categories. Well, actually, miscellaneous provisions. Foster care health insurance payments. That's what I was asking too on the health insurance payments for the foster children.
Okay,
That's
maybe,
separate and apart.
Maybe if I can just maybe clarify a little bit. What they requested to the governor in the governor's request is 7.8 million, okay? And I'm assuming that the 7.8 million is an amount they realize that is hopefully they can get. This 5.3 million, I'm not too sure exactly how they came up with this amount when they're short 5.3 million. Is it 5.3 million from the 5 million they have currently in FY23? Or is it is it from the 7.9 they're requesting in their budget requests? So I don't know how they came up with the 5.3. Okay. I need clarification.
I'd like to ask the oversight chair.
Yeah. Well, Senator Tello, the only time you had left was to get an answer, and he gave you an answer.
Okay.
And that ended that, okay? So we're going to move on to someone else because, remember, everybody's got 5 minutes now. We're going to move around.
Okay. Just point of information,
Yes,
Mr. Chair.
please.
Yeah, I think the confusion might be there was no allocation for the Division of Children's Wellness in FY23. This is a kind of new division that they created by executive order, not by law. They created the new division. They compiled BOSA and other things, including CPS in there, the foster children.
Yes.
So, but this is the first time we're allocating for it, and you gave them, and then the other confusion is that they submitted a budget request in the early parts of the budget season that was so low. And then they came in during their budget hearing saying they were $8 million below what they really needed. And they were $2 million below what the governor had even suggested for them. It was so way off. So huge error, I have to say, on public health's part. But we're trying to just fix that how we can. And then these things that they list in here, this is based on their review of the budget bill, the substitute bill. So they looked at the sub-bill and they wrote me this letter saying, we're still short, even with this sub-bill and even with the increase that OFB has given us, we're still short by this much money, and it's gonna be short in these divisions. Now, I can't take care of all those divisions, otherwise they'd have no money for anything else, but I do want to make sure, because when they list what they're short of on the the Division of Children's Wellness, they also show anticipated increase. For example, there's a 5% increase in the payments to foster parents. That's an increase that was not in FY23. There's an increase in the foster care health insurance that's increasing per child. So those are also increased, and they're trying to fund this increase of 4 positions in the CPS, which we've been pushing them. They've been unable to do it. It's super frustrating, and so that's hopefully, allocating the money for that and not giving them any wiggle room on that will make that happen faster. Thank you.
Okay, I hope that kind of cleared it up. Okay, does anyone else like to speak that has not spoken yet? Not Senator Brown.
I think this is a very good example, Mr. Chair, of showing where we have shortfalls, because obviously, you know, and I support the intent of allocating this money for these needs, because obviously we've seen the issues and concerns regarding our foster children and the need not only for them the program to be funded for their stipends that they receive, but also to ensure that these children, which we still don't know whether or not, because of they tell us the lack of social workers, are being properly visited and checked on a regular basis to ensure this health and safety and overall welfare of these children. So obviously, it's a real big concern that I have. I'm sure many have here, that we want to see these children, these that are the most in need, are taken care of. But I think it also shows the other areas of public health that are not probably going to be funded, or shortfalls in their funding. And so, colleagues, as we look at adding on other things from unappropriated funds and things of that nature, I think this zeroes in on a reality that this is what we're doing at a time again when we, you know, hear all this wonderful news about, you know, this budget increasing by another $100 million this year. And yet we're not putting more money here. We're simply saying, out of the money we're giving you, that we're giving you the flexibility to move around, you have to put this amount in these categories. So I think that's a reality, colleagues. If you think, you know, we're rolling in dough and we can just keep appropriating and appropriating from sources unknown, this is a real eye-opener, because I don't know what we're going to do if we see, as I anticipate, decreases in revenue coming in to cover what we look at as this particular case, the critical program of government service. So thank you, Mr. Chair, for the opportunity to comment.
Thank you. Seeing no other hand, Madam Speaker, if you want to close on this, your amendment, and then we can.
Yes, Mr. Chair. Of course, I propose we give them more, and I think DOE needs more, and I think public health needs more, and particularly these three divisions that they've pointed out. Yes, and if I could give even more and more and more for the CPS hiring of CPS workers, social workers, I would do that. Without the use of excess funds from FY23, it's hard to find any more basis except for there, unless we're going to go back to prior years, which I did, Mr. Chair. And I found that the audits for some of these prior years actually, so we saw that the FY21 excess on the CARER was 61 million, but the FY21 excess on the audit was only 30 million, right? So we're worried that we might be over-predicting our excess here. But when you go back to FY20, the CRER was only 19.6 million excess, and the audited surplus was 46.3 million excess. The FY19 CRER was 22.4 excess million, but the audited surplus was 35.6 million. So more of the years show the opposite trend than what was stated earlier, that the CRER is, you know, showing too much. It's actually showing too little. And they ended up with hundreds of millions in excess funds. And anyways, so I still hope we can utilize some of those. And anyways, I'd like to, thank my colleagues for the debate on this amendment. I hope it will work out so that it will, in fact, cover these that we don't have the headline again saying foster children's health insurance not paid, foster parents complaining they're not getting paid. CPS in a crisis. They are in a crisis. If anyone doesn't know that yet, they're totally in a crisis. It's just nobody's talking about it. And we tried in our oversight hearings, we've tried calling DOA, following up on the hiring of these CPS workers, and it's just the slowest thing in the world, because I don't know why, the focus. But I think if we allocate the money, this is just another tool of kind of forcing them to focus on this, because they cannot wiggle out of it anymore. They have to use it for these purposes, and hopefully then, you know, they don't put these particular people under the children's wellness in an additional made-up crisis from lack of funds. So we give them what they're asking for. We give them, hopefully, what they need, and then we demand of them to produce the results that we think the children deserve. So thank you to my colleagues. Thank you, Mr. Chair.
Thank you, Madam Speaker. Are there any objections to this amendment? I see none. Amendment passes. Madam Speaker, you got one more amendment, and then we'll recess until tomorrow.
Thank you, Mr. Chair. This is just something I found in the FY23 budget. This was it allows public health again to use the appropriation, the lump sum appropriation up front that's not already allocated specifically in any way that it wants to. And this is just in case there is any wiggle room in Medicaid or those other things where we're expecting, federal funds and matching and that type of thing to come in. So that's all that this amendment would do, allow them that authority. Thank you.
All right. Thank you, Madam Speaker. Has everybody read the amendment? Okay.
Mr. Chair, I'm sorry. Can I add, can I amend this to also add section 17? So there are certain sections where we do not allow them wiggle room. We say they must allocate those monies. And so those were listed. This is the same as what was listed in FY23. I'd like to also put section 17 in there. That's the new section that we just added by floor amendment.
Okay, Madam Speaker, just to let you know, that section 17 is really 16.
Oh,
so,
am I wrong?
So I just wanted to make sure we understood that. You don't need to add 17.
Okay, thank you.
So we're good, we're good.
Okay, wait a minute.
Because based on your amendment on the last one, it authorized legal to make the administrative changes, we kept it at 16. So we're okay in there. Senator Tello, nothing?
No, Mr. Chair, that's my concern about this section.
Just to make
yes,
it easier, maybe she won't need to close. Is there any objection or any need for discussion on this amendment? If there are none, are there any objection? None. Speaker, do you object? Okay. What, do you want to speak? Okay. No, we're going to just vote on this one and then we're going to recess. Speaker, do you care to speak on it? Otherwise, we're going to close on
No,
this.
just thank you for catching that error on the previous amendment. Thank you very much, and thank you. And I ask that legal be allowed to make changes.
Yes,
thank you.
Legal is allowed to make changes. And on this second amendment, there are no objection. It moves approved or passed. That being said, we are now there are no other amendments for Part 2 of Chapter 3. So Part 2 of Chapter 3 is closed. We will begin tomorrow with Part 3 of Chapter 3, Guam Behavioral Health and Wellness Center. Please, if you have any amendments, submit it because, are there any? There are none. When we start tomorrow at 9 and I gavel in, nothing will be accepted, okay? So let's move along and please drive safe. We are now in recess until tomorrow at 9 o'clock in the morning. Thank you.